Acyclovir, also known by the trade name Zovirax. Acyclovir is indicated for the treatment of genital herpes, herpes zoster, and varicella, also known as chickenpox. Acyclovir works by interfering with viral DNA synthesis. The therapeutic classification of acyclovir is an antiviral agent, and the pharmacologic class is a purine analog. Special considerations for nursing include watching for signs of seizures, renal failure, Stevens-Johnson syndrome, thrombotic thrombocytopenic purpura syndrome, diarrhea, dizziness, nausea, and somnolence, all of which are known side effects of acyclovir. Close monitoring of renal function during administration is important, as the renal failure caused by acyclovir can be a very acute nephrotoxicity secondary to crystallizing deposition in the kidneys. Daily assessment of any herpes or varicella lesions is important to monitor the progress of therapy, and if the patient is being treated with acyclovir for any genital infections, they should be instructed to use proper barrier protection during sexual intercourse. It is also very important to ensure that your patient is properly hydrated while receiving systemic acyclovir therapy, particularly the IV formulation. The reason for this is twofold. First, that too low of concentration of acyclovir in the IV bag can cause very high rates of thrombophlebitis. Therefore, it should generally be diluted to less than a 7 mg per milliliter concentration. Secondly, a dehydrated patient is much more likely to develop acyclovir crystal deposition in the kidneys, leading to acute nephrotoxicity. It is also important to be aware of any other nephrotoxic drugs that the patient may be receiving. There have been cases where, for instance, a patient with meningitis, not yet diagnosed viral or bacterial, may be receiving IV acyclovir and IV gentamicin concomitantly. These patients have been known to develop severe nephrotoxicity, which may sometimes be fatal.
Visit nrsng.com/50meds for our free cheat sheet covering the 50 meds every nurse must know. That's nrsng.com/50meds. This has been another MedMaster podcast by nrsng.com with your host, licensed pharmacist Cody Magnuson, BSc, PharmD candidate. Now, from all of us at NRSNG, thanks for being here and happy nursing.